In this short video, we will learn how to enter lab observations manually so that they can be recognized by the clinical decision support tools like goals, triggers, and reporting in MedAccess. In most jurisdictions, labs come in automatically. However, there may be instances when perhaps we didn't order the lab and we have a paper copy of the result. We may have pulled it off of NetCare, or the result gets sent to us by a particular specialty or program, or even if the patient gets it done outside the areas that send their labs electronically. Simply scanning in a result instead of entering the actual result as discrete data will prevent our tools from finding it easily. To enter a result manually, you first need to create the discrete data field, or as it is called in MedAccess, the observation. Once this is done, it can be used repeatedly, so you only need to do this part once. In order to do this, you should first look up a patient who has actually had the particular test you wish to enter done, so that you can copy exactly how it is sent from the lab. It's also a good idea to write down the normal range and the units that it comes in as well. Once you've done this, you can begin. So let's say I needed to enter a ferritin result. I check the patient that's had it done and I see that it's called ferritin. The units it comes in is micrograms per liter and the normal range is 12 to 300. Once I have all this information, I can begin creating the observation. I go to templates, and then observation templates, and there I select the types icon and I select new. There's just a few fields you should worry about filling in with lab values. The first of course is the observation name. Once again, I call it exactly the way it's called from the lab. If it's a complex one, it's a good idea to copy and paste it. The next field I complete is a data type. Here I select numeric because it comes in as a numeric result. Under the units, I put my micrograms per liter. And then here is a display range, and I want to put that so that it shows beside the results so people can see if it's either high or low or normal. So there we put 12 to 300 micrograms per liter as the normal range. I can also enter the lower and the higher range if I'm using this observation in a CDS trigger or goals. That way it'll flag as such. And then I just update the observation. Now I'm not going to do it in this case because we already have it in this particular clinic as an observation. Now when I'm ready to use that observation, I go to the patient that I wanted to add it to. Just pull up my test patients here. And then I click on the Labs tab. And just notice here that it's showing that this particular patient has a ferritin that's overdue. Now I'm going to click on this result icon in Labs. And then I'm going to click on these three little lines on the result banner here on the right. And that opens a menu and I click on Add Observation. And that's where I type in the observation I just created. Notice that it's now added a discrete data field where I can enter my results. It has the units there. There's a box that opens up in case there's any comments that come from the lab that you wanted to enter. And I'm just going to put the result of 320. And it also gives you the opportunity to flag it as high if you need to or low. Now the other really important thing you should remember when you're entering a result is make sure you select the proper observation date. So when was this lab actually done? So I'm going to say it was done in December 2016, December 14th. and make sure you complete the ordering provider. You can then assign this task to whoever needs to review this result, or if you're the one that's already reviewed it, you can just complete the task at this point. And now you'll see that our ferritin result, it's showing up in red because we flagged it as high. And the other nice thing is our goals has just updated. This goal was a goal that needed to be done every 3 months, so you'll see that it's now put the new result in, and it's telling us when the next one needs to be done.